Where have all the providers gone? We have a real crisis here in the United States. This is a micro lesson combining part of Chapter 4, Providers, and Chapter 13, Health Policy. But more importantly than that, for all of us, and many of you who are going to go into healthcare planning someday or be part of the healthcare workforce, we have a real situation. The American Association of Medical Colleges estimates that there will be a shortage of between 40,000 and 105,000 physicians by the year 2030. So that means if you think you have trouble finding an appointment now for that critical medical need, you're going to have a real serious challenge in the future. And so will your family and your children and everyone else that you care about. And it's important to note that this study considered the fact that we have already increased the use of physician assistants and nurse practitioners across the healthcare workforce. They also considered the fact that there were issues with delayed retirement, and people say, well, I know a lot of older doctors that are still working. Well, that's a band-aid for now, but things are going to get worse and worse. So what can we do about all this? Many of you may be familiar. In fact, I think a couple of our students work in the GME area. GME stands for Graduate Medical Education. And those are the folks that basically provide, not only, they help students, after people graduate from medical school, as many of you are aware, they have to go on and do a residency. And the graduate medical education people provide those residencies. Carilion, the parent of Jefferson College of Health Sciences, has a GME program, very strong GME program. And so what you're seeing around the country is people are pouring more money into GME, and we really just can't get enough because we need to hire and train, or we need to train more physicians so there are more physicians out there to hire. So what can we do about this? Well, this is where it really becomes a health policy issue. We need to start by funding and encouraging our children to study STEM. We need kids to think that being a doctor is cool, and it's the appropriately trained and students who have the aptitude for it can become doctors someday. We need to encourage medical education. We need to fund medical education, and we need to fund the medical practices once they get out. I mean, there are programs out there you may have heard. Sometimes if you have someone who's willing to go work in a rural area for a couple years, there's forgiveness of medical education, student loans. And of course that costs money. So that requires funding either from Congress or from very creative medical health systems, or even from Dare to Dream, maybe a health insurance company. And finally, we need to continue to use a more multidisciplinary approach to how we deliver medicine in the United States. And many of you are part of that. And it's wonderful that we have so many students here at Jefferson who are studying all kinds of provider areas where they can help. And many of you may even decide to go on and become a physician. So that's the micro lesson. Where have all the providers gone? Yes, we have a problem, but we also have solutions, and hopefully many of you will be part of that solution in the future.